Hi, this is Elliot Fishman, and welcome. Look, I got my hair combed and everything. Okay. Anyway, we're on YouTube Live, and we're trying to do YouTube Live. Hi, Lily. Lily's been texting me to make sure I get online. So, just a few things. The title of this talk was something like AI and the Referring Physician, and I'll tell you what made me think about it. I was reading a bunch of articles, and some of them are posted on CTisus, so some will be posted in the AI section. And it really was very, very positive AI results. And it was on simple things. It wasn't like early detection of pancreatic cancer on a CT scan. It was something like fractures, accuracy of picking up pneumonia. Some of the things that are very, very core, basic ER functions. Now, the discussion always is if AI gets good, what's the role of radiologists? Consultant, increase your RVUs, do more cases. There's always discussion if computers are good, will the RVU reimbursements go down? There's all sorts of things like that. And the question always becomes also, will the radiologists be out jobs? People argue it's not going to change anything. Some people say it will. Some people say it'll change how things, like for example, if the results on mammography is so good with AI, which right now it shows that AI at this point is better than most mammographers, then you're going to see something where the computer does the AI, and only when the computer has a question will the radiologist get involved, or maybe the radiologist will not be involved at all. But that's all fine and good. But I'm asking a different question. Let's talk about trauma. In the ER setting, in many places, in most places, there's no doc present. Some people use teleradiology, but in most cases, the ER doctor is looking at the films, and perhaps tomorrow the radiologist will look at it. The ER doc is not billing. There's always this argument about that. Remember, ERs are getting more and more, they're becoming more corporate, right? You have certain corporations, that on the stock market, that own ER groups that cover hundreds and thousands of ER settings. So my question is this, not what's the role of radiologists in AI in terms of reading or not reading or how it helps. My question is a different one. If you look at the articles recently published, it showed that with AI, the non-radiologists were essentially as good as the radiologists. Yes, AI helped the non-radiologists do better, perhaps. And so maybe it would improve them by 15% and improve the radiologists by 4%. So it helped the non-radiologists more. But if the end result is that the accuracy is the same for the radiologist and the non-radiologist, why do you need the radiologist? And in this era where people are looking at costs and efficiency, I could see where if AI gets really good, then the non-radiologists, be they ER docs or orthopedic surgeons who have always kind of been pushing the envelope, trying to get more involved in radiology, they're going to say that AI works with them and they could do the official reads. Because yes, I may not be as good as the radiologist one-to-one, but me and AI is the same as the radiologist and AI. We're both going to get the same answers. We're both going to have the same accuracy. The difference is I know the patient. I'm at the point of care. I'm there 24/7. I will make the decision and manage and not wait for a radiologist report to come down the line somewhere else. Now, I bring this up also in the era of COVID, or hopefully we're coming out of COVID, when more and more radiologists read from home. Now, there was always radiologists reading from home. That's the whole thing of teleradiology. Paul Berger started that years ago, a couple decades ago. But more and more other groups, big academic institutions, have a lot of people who read from home, and people like it. There is certain advantages reading from home. Now, I will admit, I think all of us will admit that teaching doesn't do, you can BS and say, oh yes, I could teach on Microsoft and I could teach on Zoom. Reality is, teaching is when you're sitting next to the person. I think we all honestly will agree to that. So the question is now, if radiologists aren't in point of care, if radiologists are constantly complaining about having to do multidisciplinary conferences because they're not getting RVUs, if radiologists are complaining about everything all the time, it's a tremendous opportunity for the referring clinicians who are at point of care, at and with the patient, to be able to take over the entire process. So what I'm asking you, I'm not telling you, and I'm not suggesting, but one of the things you need to be thinking about, if radiologists don't return to work, if radiologists continue to be remote, and even when we were in place, people would say you're kind of remote, right? But if we're not doing those multidisciplinary conferences, or we're doing them begrudgingly, or if we're not at point of care and we're not working with referring physicians and we're not working with the residents, then I think you're going to see where the referring docs who are well trained, who are willing to be trained, and when you have big corporations who look at the P&L, you can imagine the difference from P&L if the ER docs are billing for reading the films rather than simply reading them, taking the risk, and have the radiologist read the next day. I'm saying that's the paradigm shift. That's the paradigm change. It's not the radiologist with AI, without AI, who's billing, how much is going on, what's your accuracy, what's your speed, what's your RVUs. I'm saying, what if you end up with AI being the great equalizer, equalizing what a non-radiologist can do with what a radiologist can do? Then you've changed everything, because now you can imagine them bundling the cost of the imaging, at least the professional side of things, with the cost of seeing the patient, which would be what ER docs, orthopedic surgeons would like to see happen. So I'm saying, and I'm suggesting, and I'm just bringing up the conversation. We're writing an article about it, Steve Rowland, and Chu, myself, that it's something you need to think about. If AI, there's articles in Radiologist Month showing how good AI is in fractures. If AI can be as good as a radiologist in fractures, then you don't need the radiologist, because the referring doc is going to step in, and he's examined the patient, and he's touched the patient, and he can look at the films and do a good job as well. So that's my question today. What are we going to do? What are you going to do to avoid that challenge? How are we going to enhance what we do, get back to where we were, or take things to a higher level in order to be of importance in the AI era? Again, AI is not just for radiologists, it's for everybody. And if AI plus an orthopedic surgeon, or AI plus an ER doc, can do as well as us at the end of the day, then I think we're going to have a problem. Now, in terms of questions, let me see real fast. Who watching is using AI in their practice? People can answer that, but the ACR published something that about 30% of people are using AI a little bit. Sometimes the AI is being used for scheduling or for things like that. I think it's this. It's going to be like a tsunami. I think we're at the part now where the water's going back, and you think everything is good. Oh, look at this big beach I have. Remember, tsunamis go back and then hit. I think we're at the point now where the water is just beginning to go back, and if you're not careful, if you don't go to high ground, you're toast. So I don't know the answers. I don't know for sure, and I'm just bringing it up, and it's worth discussing. And that's me. We're in YouTube studio. I'm in my office. That's Max and Sam's posters. And I have to go because 12 o'clock, I give my faculty, resident, fellow Wednesday quiz conference. So I'm going to quiz the people and make sure they all have jobs when all is said and done. So with that, I thank everybody for their attention. Have any comments, suggestions, put it down. We're trying to build up our YouTube. We have 35,000 people plus who are signed up for our YouTube channel. We have thousands of videos, and we are trying to create all sorts of new information. So with that, have a great day.